You ever catch yourself in the mirror and you're like, hold on, what is that?
Happens to the best of us. What you looking at?
It's like this tiny little white bump right under my eye. It's not a pimple. It's not going anywhere. It's officially got me curious.
Ah, you're talking about Milia. Yeah, those little guys can be tricky.
Milia. Okay, that's the official term. So for this deep dive, that's what we're tackling. Milia, what they are, why we get them, and most importantly,
How to evict those suckers. I'm with you.
exactly. I've been reading about this all week, and let me tell you, some of this stuff surprised even me. But before we get into all that, let's start with the basics. What are milia exactly?
So, in the simplest terms, they're these teeny tiny cysts.
Cysts. Oh no, that sounds kind of serious.
Don't worry, not the kind you need to panic about. Unlike regular cysts, these aren't filled with fluid, they're actually packed with keratin.
Wait, keratin. Like what our hair and nails are made of.
Bingo. It's kind of wild when you think about it, right? The same stuff that makes your nails strong can end up forming these little bumps under your skin.
Okay, that actually makes so much sense. They always feel different from a pimple. Way less
Squishy.
squishy. More like a little grain of sand got stuck.
Exactly. And that's the keratin. It's a tough protein. That's why it doesn't just disappear overnight.
Okay, but why under the eyes? Is there something about that area that's like prime milia real estate?
You know, it's funny you say that. Yeah, they do seem to love setting up shop under the eyes, partly because the skin there is so thin and delicate. But don't worry, you can get them in other spots too, like on your cheeks, eyelids, even on your lips sometimes.
Oh, fun. But we're talking about adults here, right? Babies can get those little white bumps too, and I'm guessing those are a whole other thing.
You are correct. Baby milia and adult milia, two different beasts entirely. Newborns, it's totally normal and usually nothing to worry about. They'll disappear on their own within a few weeks, no problem.
But for us grown-ups, not so simple, huh? So what causes them in adults then? Is it just a matter of having like too much keratin, asking for a friend who has really strong nails?
Haha, I love it. Well, it's not quite as simple as having an excess of keratin. It's more about how that keratin gets trapped under the skin, which can happen for a bunch of reasons.
Hmm.
In adults, milia are often linked to some kind of skin damage, even if it's really minor.
Interesting. So it's not just about what's going on inside our bodies,
Yeah.
but also about how our skin reacts to things in the environment.
Exactly.
Okay, getting even more interesting. So to be precise, we were talking about different types of milia earlier. I know you mentioned primary and secondary. What's the deal with that?
Right. So primary milia, they form directly from that keratin buildup. Think of it like a little traffic jam in your skin's natural exfoliation process. But secondary milia, those are the ones that pop up because something is actually blocking the skin's surface.
Okay, now we're getting somewhere.
Yeah.
So as secondary milia, what kinds of things cause that blockage?
Well, basically anything that causes trauma to the skin can be the culprit. Think burns, blisters, heck, even those little bumps you get from poison ivy.
No way, really. Poison ivy can cause milia.
Yep. It's like your skin's natural healing process goes a little haywire and starts churning out extra keratin, and bam, Milia City.
That's officially the last souvenir I need from a camping trip. Thank you very much. So skin injuries, got it. What else?
Oh, tons of things. Sun damage is a big one, especially if you're not protecting your skin. And then there are the usual suspects. Heavy creams and oils that clog your pores. Those can definitely contribute to the problem.
Makes sense. Got to keep those pores squeaky clean.
Exactly. Although here's a funny thing. Even some skin resurfacing treatments like lasers or chemical peels, they can sometimes trigger milia too. It's all about finding that sweet spot for your skin.
Oh, wow. So it's a delicate balance. Too much of a good thing, I guess. You know, we were talking about baby milia earlier, and I bet a lot of new parents listening are probably wondering about baby acne. How can you tell the difference?
It's easy to get those two confused, especially since they both show up as these little white bumps. But baby acne is all about those hormone fluctuations newborns go through. It usually clears up within a couple of months, pops. Milia, on the other hand, are those keratin-filled cysts we were talking about.
Got it. So different causes, different timelines, different ways to deal with them. Which brings me to the question I know everyone's dying to ask. How do we get rid of these things?
Well, the good news is milia are usually harmless. Unlike those pesky pimples, they're not inflamed or infected, so they don't need treatment unless they're really bugging you.
Okay, that's reassuring. But I'll be honest, I'm not a fan of the look. So if we do want to say, see ya later to these little bumps, what are our options?
Honestly, if you're concerned or they're bothering you, a dermatologist is your best bet. They've got the expertise and the tools to assess the situation properly.
Okay, that makes sense. So what can a dermatologist do that, we can't do at home with a YouTube tutorial and a prayer?
For starters, they have sterile instruments, which is important. One common in-office procedure is called de-roofing, which sounds a little intense, but it's actually pretty straightforward.
De-roofing. Okay, that's definitely going on my line of words I never want to hear in a medical context again. But tell me more. What is it?
Basically, they use a teeny tiny sterile needle to make a small opening in the skin and gently remove the keratin buildup.
Okay, noted. Definitely not something to try at home then.
Yeah.
What else do they have up their sleeve, dermatologically speaking?
Another option is cryotherapy. That's where they apply liquid nitrogen to the milia, which freezes and destroys the cells.
Cryotherapy. Okay, now we're talking. I've always wanted to try that.
It's pretty cool, literally. And then, of course, there's laser ablation, where they use a special laser to target and vaporize the milia. Very precise, very effective.
Okay, so we've got options if we decide to go the professional route. But for those of us who might be, let's just say, dermatologically challenged when it comes to booking appointments, what about those at-home remedies? For the brave souls out
Oh,
there.
absolutely. There are definitely a few things you can try at home to encourage those milia to pack their bags and move on. Gentle exfoliation is always a good place to start.
Okay, so like a mini spa day for our faces,
Mm-hmm.
but with the added bonus of milia busting, I'm in. What kind of exfoliation are we talking about here?
Exactly. Think like a warm washcloth or a gentle scrub that's made for your face. But remember, that skin around your eyes is super delicate, so no harsh scrubbing allowed.
Got it. Gentle and consistent, just like with everything else in skincare. What else can we try at home?
Steaming can actually be really helpful.
Wait, really? Just from like taking a hot shower?
Exactly. That steam helps soften the skin and open up your pores, and sometimes that's all you need to dislodge those stubborn little bumps.
See, this is why I love a good deep dive. So much good info. Okay, what about all those over-the-counter products? Any ingredients we should look for?
Definitely. You want to look for products that have alpha hydroxy acids, things like glycolic acid, lactic acid, those are good ones. Salicylic acid, that's another winner. They all help to exfoliate the skin, which can be really effective with milia.
Got it. Exfoliation is the name of the game.
Mm-hmm.
Okay, but I have to ask, and please tell me if this is a terrible idea, are we allowed to extract them ourselves?
It's so tempting, but trust me, it's not worth the risk.
Yeah, that's what I thought. But just to be sure, what's the worst that could happen?
Well, picking or squeezing, it can actually push that keratin deeper into your skin. And then you're talking inflammation, infection, maybe even scarring. Plus, you're introducing bacteria into the area, which is like the opposite of what you want.
Okay, you officially scared me off. Hands off the Milia, everybody. So let's say we've dealt with the Milia we've got, either with a dermatologist or with some of these at-home remedies. Is there anything we can do to prevent those bumps from showing up in the first place?
Absolutely. A lot of it comes back to having a really solid skincare routine and being consistent with it. That's key.
Music to my ears. I love a good routine. So we're talking, what, gentle cleansing, exfoliating a couple times a week, moisturizing?
You got it. And here's a pro tip. Look for oil-free products, especially for your face. Oils can clog pores, which can sometimes lead to those milia, especially those secondary ones we were talking about.
Makes sense. I've definitely been guilty of going a little heavy on the face oils before. Note to self, less is more. What about those serums with vitamin E or vitamin A? Are those helpful at all?
They can be. Vitamin E is a powerful antioxidant, which is always a good thing. And topical vitamin A, you'll usually find that in retinol products, can help with cell turnover, both great for overall skin health.
Okay, so a good diet, good skincare routine, maybe a little vitamin boost.
Yeah.
It really seems like the key with Milia is just taking good care of your skin in general.
100%. It's about working with your skin, not against it.
I love that. Well, on that note, we've learned a lot today. We learned that Milia are super common, they're usually harmless, and with a bit of skincare know-how, we can prevent them. We also learned that picking is a big no-no, which is worth repeating, I think.
Totally agree. Resist the urge.
Yes. And hey, if those Milia are driving you crazy, see a dermatologist. They've got the knowledge and the tools to help you out. I learned so much today, I feel way more knowledgeable about Milia now. Thanks for taking this deep dive with me.
It was my pleasure. Hopefully everyone listening feels a bit more confident about those little bumps now.
I hope so too. And for anyone listening who wants to dive into the research themselves, we'll be sure to link all of our sources in the show notes. Until next time, stay curious.